So again, Ramadan Mubarak to everybody. MashaAllah, things have actually going well. It has been easier than I thought it would be. We started out with like 15 and a half hours, and by the time we end the month, it will be 16 hours. For people on the West Coast, like Sabrina, it will be more like 16 and a half to 17 hours, actually. So, but even that is working out well. Uh, so when I hard working and fasting feeds the soul was a summary of what Ramadan is actually all about in a nutshell. So the last year was put everything up on its head. Things were topsy turvy. We could then do most of our usual work. The clinics had to be shut down, and we had to deal with two issues, not just one. One was the COVID, and what happened when it was shut down was we moved to supplying oxygen cylinders to patients, to people who were in lockdown. They were getting food easily, so we didn't have to supply food, oxygen cylinders. We also had to supply them with medication like chemotherapy like medications, which they couldn't go out and buy. So we took on the responsibility, Health Hyderabad took on the responsibility to do that. We also gave some small amounts of money to people who were completely run out of funds. We gave them some small, limited donations as well. The next thing we did was, in cooperation with a number of other organizations who were doing similar work in Hyderabad, now they actually have the group called Ta'awun Cooperation. A number of vans were purchased, and as you can see, one of these was the van that we paid for. It says up here, AMPI, Help Hyderabad COVID Relief, and this was used for multiple purposes. It was used to deliver oxygen cylinders. It was used sometimes if somebody passed away, it acted as a hearse. It was also used to bring patients to a hospital. Now, the other thing that hit Hyderabad was, of course, the flood. As you know, in so many parts of India, because of heavy construction, all bodies of water are disappearing, and the same thing is true. And there was a heavy rain, so with rain there are floods. And near our refugee camp, the Rohingya clinic, there is a lake called the Balapu Lake. So our clinic is on one side of the lake, and the 31 camps are on the other side. So the Balapur Lake flooded, and it flooded the clinic as well, and flooded the entire neighborhood. And some of it was pretty impressive. You can see some of the homes that were destroyed. So again, we paid money to help with that as well. Here is some of the relief we have provided. This is actually near the clinic itself. We see how people have gathered, and we did that. The other thing we did was Mr. Modi, with a 4-hour notice, shut down, made a lockdown, and all of the poor people lived in Bombay and Delhi, but also in Hyderabad, they live by with 1 to 2 days of, they don't work for 2 days, they go hungry. So all of a sudden, there were hundreds and thousands of people who were walking. They did not have any transportation. So when we heard that, we immediately sent a check of $10,000 to Harsh Mandar's group in Delhi so that he can start feeding or provide some help to those people. In Hyderabad itself, we also hired a couple of buses, and we paid for 2 of them so that the people there can be taken over to the places of where they came from. So that's the clinics are now open. I'm not sure what will happen with the second wave. They are still open. Zayed Khadri may join us later, and that may tell us what's actually going on. So these are some pictures of the clinic. On the left is a clinic. I don't know if you can see uh, my pointer, but the really bright and shiny area is the Falaknuma clinic near Falaknuma. It's now called Bibi Nagar. And it now has three physicians and a dentist. There's one in the afternoon and two in the evening, one male and one female, and a dentist. The picture on the right with a darker flooring is the Hashmat Pate Clinic, and there is a nurse who is doing the intake. This is the Hashmat Pate Clinic. Again, they both have fairly well-stocked pharmacies, and they took quite a stringent precautions so that we don't spread any COVID. Uh, Here is an example of Hashmat Pate Clinic. Again, our clinics, even though this is a Muslim-funded organization, but we service everybody. It's a non-denominational, Hindus and Muslims. So here is one of the patients who's coming. I don't know if you can hear her, but she was talking both in Urdu and Telugu. She was talking mostly in Telugu, a little bit in Urdu. And so about 40% of patients in the Hashmat Pate Clinic, I believe, are Hindu. Even in Falaknuma Clinic, which is a combination of 5 slums, it's come together and there is a common conduit out. A significant number, like 15 to 20%, are now Hindu patients, which is exactly what we wanted. We have also been successful in starting dental clinics. As you know, we looked at what kind of patients coming in, and then they said supply their needs. So we have a dermatologist who's coming in twice a month. We initially thought we should get a diabetes specialist, but the physicians were there. They're all MBBS physicians. They said we can deal with it, we can handle that. So that's not an issue. But we found out that the dental care was much needed. So we have dental clinics, both in Hashmat Pate and in Falaknuma. Now, those are very expensive. The supplies, the setup are much more expensive than renting a regular clinic. One of our dentists is this young man here. He's very good and very popular with the local community as well. And he sometimes brings his own supplies as and then the other person we have is actually a female dentist. And again, you can see what kind of precautions they're taking. It's a little bit more than just regular checkups. They're actually, you can see, it's almost like doing some mini surgery. So all of the clinics, we have made sure that they are absolutely clean. All of the physicians at MBBS. So we said, made sure that the patients who come in, all of the clients who come in, are treated with kindness and dignity. That's very important. These are very poor people. As you know, in the slums, what happens is all of the men go out to work to get day labor. So all you're left with is women and children and old men. And so we have set up these clinics as well as the Rohingya clinic center. And I'll talk about the Delhi stuff in a second, so that people can walk to it. The women and children, bring them in, and you will see they come in their best clothes, and they're treated with dignity and respect. They sit down there, they get everything for free, and there is no check of what their income is. We have surveyed the communities, and we have been very happy. We also keep track of how the physicians are treating them. We do have some CCTV cameras, and if you get a complaint or we see one of the physicians being irritable or short with the patients, we kindly ask them either change their behavior or we replaced with somebody else. So right now we have two dentists, we have four physicians in these two clinics, plus two physicians in the Rohingya clinic. So the dentists are very proud of their work, and one of them sent me the stuff they had done. I think when I go there, I might get some dental work done as well. Again, our pharmacies are well stocked, and we are also started doing basic lab work. The blood is collected and sent out. By the way, in the pharmacies, we're using generic medications, but really everything is pretty well stocked. And for lab work also, we have an outside group that is helping with us and giving us doing the lab test for us at a discounted price. So we are doing that as well. Uh, we have also been supporting right from the beginning. We started this venture, with a group of Muslim physicians sitting here doing nothing. We said, we love India, we need to give back to it the best way we can. So we did two things. We said we should concentrate on healthcare because we know a little bit about healthcare. So we'd actually try and figure out if things are being done well or not. And then we said we select out groups of patients people who are most in need. One is people who are moved into slums because of internal migration. People who come from villages and they find a job in some construction, like Cyber City in Hyderabad, where they may make Microsoft billing, and then they don't have any job, so they stay. So we did that. We also started working right from the beginning with Harsh Mandar. I don't know if everyone of you knows Harsh Mandar. He's like a wonderful person. He's actually, I think, channeled Mahatma Gandhi's, his his ideals into him. He's really a wonderful, wonderful person. So we were trying to help his work there. Initially, we helped a mobile clinic he was running, and then right now we are helping the shelter. So people who live on the sidewalk, they get different kind of injuries, mostly ulcers and injuries from traffic accident, fall, fractures. And there is a hospital that is working with the Harshmanda's group. When they stay there, they have to come out and get rehab before they go out again. So we are now supporting this group. Initially, we were the major supporter, but other people have now come in. So basically, that's all I wanted to share with you. And I just want to show you a picture of how when these kids come in and the parents bring their children in, how nicely they dress them up. So thank you very much.